Hello, y'all. Once again, Commissioner David Stout here. We're doing our second Sunday conversation. This time we are graced with the presence of Dr. Alan Tyroch. He is Chief of Staff, Chief of Surgery, and Trauma Medical Director at University Medical Center. Dr. Tyroch, thank you very much for joining us.
Thanks for having
this
me.
segment.
It's a pleasure.
It's great to have you here. So, we're really pleased that you can be here with us, and as we teased in our ad that we did for this earlier this month, we wanted you to come in and talk to us about UMC's response to the August 3rd tragedy that happened here in El Paso, and we've just passed the 6-month. Time flies. It does. But we wanted to check in with you and kind of talk to you about what happened that day and what's happened since then. So first of all, can you just tell us how that day unfolded? How did August 3rd unfold for you all? I understand that you were not in El Paso.
I was actually out of state. I was in Vegas at the time. I have this thing called text messaging from EMS. So there's more than 4 victims of anything like a car crash, even if it's a minor crash, I get notified. So I got the active shooter notification. And, we'll get stuff like this, as there may be somebody with a gun. It's usually not really true. That was my first thought. So I called the hospital, I said, is this real? And the answer was, yeah, we're probably gonna get 5 victims, maybe more. So I called Ms. Jacobson, the CEO, I called the trauma program manager, I said, we're getting 5 victims at least, or maybe more. So I called back. And they said, we're getting 10 plus. So I ran to my hotel room and got my wife to get me on the next Southwest plane to El Paso, and I got here within 2 hours, thankfully. You can really go through TSA when you want to. So I pushed my way through, got here around 2:30 or 2:15, did the conference with, the interview with the hospital. And there was a lot of heroes that day. A lot of people that really stood up. And I'm talking actually, first of all, the people at Walmart, what we call immediate responders, which is just the usual people walking down the street. They stopped the bleeding, they put pressure on, they helped people move people out. We saw the hero that they finally identified. And then the what we call first responders, which is EMS and police. So they got the patients to us quickly. We mobilized. We had adequate number of physicians and nurses and all the support personnel. And we saw 14 patients in 34 minutes. We had 4 operating rooms running simultaneously. And it was all over very quickly. That part, I always tell people, it starts as a sprint, ends as a marathon. Don't run out of gas, because that was one of the things I was worried about on Saturday and Sunday. But we did a very good job. We stood up very well that day. And we practiced, just like all the other hospitals in El Paso. We actually had an active shooter drill at the airport in October, where there was an active shooter at the airport with 100 victims. So we knew what we were doing, I think, that day. And it worked really well.
Yeah, no, I know I've heard that you're a big believer in the notion that you play how you practice, right?
Play like you practice.
And with that in mind, what does it take actually what kind of training, to be able to respond to something? And when you have, you said 15.
14 that day.
14
we got
that
one
day
more the next day.
And one more the next day, so 15 in total. What does it take just, I guess, not just the coordinating of that, but also the mental preparedness that you have to go through as folks that are responding to something like this?
Sure. Well, first of all, we all do something called ATLS, Advanced Trauma Life Support. So we learn how to manage a patient. So when some patient comes in, just one patient, just with devastating, horrific injuries, you don't lose track of what you're supposed to do. We do something called ABCs, airway, breathing, circulation. So I tell my surgery residents, when you forget what's going on, if you're not sure what's happening, just go back to your ABCs, airway, breathing, circulation, and then that gets you back to what you need to do to take care of the patient. And that's one of the things we learn. As we said, we do the disaster training twice a year at least. We did it community-wide once a year. And just drill, drill, drill. I'm the biggest critic of our disaster preparation. Guys go, I said, we look crappy today. We did a terrible job. Or this fell apart, that didn't do well. But I can tell you that Saturday, it really fell into place. And that's why I said we had a lot of leaders and heroes that day, because people really stood up. Not just the doctors or the nurses, even the example I use is housekeeping, environmental services. They went into the trauma bays, cleaned up from one patient so we could get to the next patient immediately, and then same thing in the operating rooms. They were going in there and cleaning up the the blood and all the stuff so we could get a next patient in. So those people were heroes also.
Definitely. Was what you found that day when you got to the hospital, was it much different than what you expected to see when you heard about it?
Actually, it was more calm than I thought. So when I was texting, communicating in Las Vegas when I was at the airport, got on the plane, they always make you turn off your phone. My last communication was, there may be 60 victims. And that's the last thing I thought about on the plane. I was like, there's nothing I can do now. I said, just say a prayer, take a nap, because this is going to go crazy for a while. So I got to the airport. Jacob Cintron called me just as I got off the plane. I had 56 texts just from there to here. I tried I'm going to triage which ones aren't important. Jacob calls, says, I need you. I said, let me get over there. And I thought there was going to be chaos. It was very organized. The dust had already settled. And I was like, I should be doing something more. My adrenaline was still up when everybody else said, all right, there's it, calm down. So I was a little surprised, which was a good thing.
Yeah, definitely. From going to thinking there's going to be chaos and getting there and just, calm and that
people did their job.
I think exactly. I think that just goes to show that the training work that the hours and hours that you all have spent preparing yourself. It certainly paid off.
I felt a little guilty for not being there at the beginning, but then I started thinking, well, you know what? Everybody did their job. That was good. I don't need to be here. So that was helpful for me to hear that.
Sure. What are some of the lessons that you all have taken away from the event and.
So yeah, we've done debriefings. You can always learn. I always tell people, you can win the football game, you can score a touchdown, but if you go back and play the video the next day, you see, well, that guy missed his block or you didn't run your assignment. There's always things you can do better. For the most part, I can't be super critical, but there's some things we learn, like maybe better communication, maybe a little bit better group communication, just to make sure we're getting the patients identified. That was the most difficult thing for us, is identifying the patients. We had a hard time with that, not just us, but all the hospitals. We were told one thing, and it actually wasn't the right patient. We were looking for one person for quite some time, and it turns out it was a different patient who actually expired or died at the scene. So that was a little difficult. So that's just not at the hospital, but at what we call the board of RAC, the Regional Advisory Council. We're taking that back. How can we do a better job, even with law enforcement, with the FBI, and other agencies, to how we can better coordinate identification of patients. But all in all, when I've gone to other meetings, because I've talked to a lot of people like from Vegas, Orlando, they have the same problems. It's chaos, and you just got to work through that chaos. And I must say we actually were pretty good that day. Not just us. Del Sol was good. The 2 tenant hospitals that saw patients, EMS, fire, and everybody else, and police, we really did a good job. Even the community, we donating blood. So I was pleasantly surprised. I was very, very proud of the city.
Yeah, definitely.
We grew up that day.
This tragedy was devastating, but I think it really brought this community together. I think it really showed the strength of this community and how just on every level people care for each other and the way that everybody reacted.
And still are. We're really close.
Right. And something like this can only bring you closer, I think, right? And so how are y'all taking care of yourselves? How are y'all feeling? Yeah. How's your staff feeling, 6 months after the tragedy?
So that was one of my biggest concerns. I told President Lang from Texas Tech and Jacob that Sunday, I said, listen, we're going to get PTSD. It happens. It's not maybe, it's going to happen. And it affects about 1/3 to 50% of people that are involved in this. And we did some stuff early on where we had some group discussions where we got together and just commiserated and talked about that day. And we sort of, at that point, we could laugh and joke about some of the things that, could have gone better or differently. So I always tell people, we did it as a big group at Texas Tech, and then we got like my surgery department together. I always say, it's good to get your little tribe together so you can just talk about things and, just work your way through it. And then for those that needed professional counseling, which is okay, people were able to do that at the hospital and at Texas Tech, and I know EMS and everybody else have done the same thing. We got some outside experts to help with that. There's been a study that came out of the Orlando shooting where 35% of surgery residents had PTSD 1 month after, and then another 30% still had it 7 months later. So we're still in that phase. The city is still in that phase. I'm going to give a talk in 2 weeks at Texas Tech about that 6 months later, a little after effect, so see how we're doing.
I think definitely that's very important. The mental health care aspect of not just the victims and their families, but the folks that work for you that were there that day.
Sure.
I'm very happy to hear that you all are.
I think for the most part we're doing really well. Some of the things that helped, and we can take the politics out of it. When Trump came, that actually helped. It actually allowed people, Democrat, Republican, liberal, conservative, were able to see him and smile a little bit and laugh. That was a little bit nice. What was really great was the memorial at the Chihuahua Stadium, I don't know when it was, 10 days later. That was part of the healing process, and that's one of the things I was taught from other events like this, active shooters and just disasters. Get together as a community.
Well, we really appreciate everything that you and your team did. There's so many heroes in this story, so many heroes in this story, and I think our community is going to be, forever indebted to y'all and the families, that I've spoken with, not just on that day, but patients in general that go to UMC. I think speak very highly of the care that they get there. So
I appreciate that. UMC is a great place.
It really is, and we're happy to and proud to have you on staff there. And I wanted to, before we finish, just ask you a little bit about yourself when you're not saving people's lives and being the hero that you are. What do you do for fun besides going to Las Vegas?
Well, actually, no. I didn't want to go to Vegas, so that was my mother-in-law's 89th birthday, so that was her bucket list to go to Vegas like she used to do with her kids. What I do for fun? Usually just sit on the couch and fall asleep. I go hiking a lot, raising tropical fish, saltwater fish, and gardening. Not very good at any of those, except for sleeping on the couch. Yeah,
that's not a bad pastime. What are some of your favorite things in El Paso? What keeps you here? Why do you like El Paso so much?
It's a great place. I came here in 1997 to help set up the trauma program at Thomason Hospital, a very poor county hospital. We had no idea what we were doing, and I thought I'd be here 4 or 5 years, move on to a bigger academic program. But I saw a lot of potential, not just at the county hospital, not just at Texas Tech, but the city. The city has just undergone a renaissance in the last few years. Downtown is revitalized. In the UTEP is growing, it's Tier 1 status. Texas Tech is just amazing how we are accelerating. As I mentioned earlier before we talked on live here, is that it used to be so difficult to recruit physicians here. And now I am just amazed at the caliber of people we've been able to bring on. I tell new candidates, I says, you know what? El Paso is the 6th largest city in Texas. It's actually the 22nd largest city in the country. And people are like, no way. I go, it really is. Actually, we were 19th 2 years ago.
Yeah.
We dropped because other places moved.
Yeah.
But we're a big area. My trauma area is 1.3 million people. That means that's our surgery area. That means that's what the health sciences can provide. The El Paso del Norte area is it's amazing. I mean, look at the weather was neat today. I thought the snow was great. But tomorrow it'll probably be 60 degrees, and man, you don't get that in most places. So it's a great place. It's a safe place, and it's a fun place.
Well, that said, I really appreciate you joining me today and this new endeavor that we're working on here in my office, trying to inform people about things that are going on in our precinct. And thank you for everything that you do for our community.
Thank you, and thank you for what you do for the precinct and the hospital and for the people. Appreciate it, seriously.
Thank you all for joining us. That's a wrap on our second Sunday conversation. we will see you next month. Thank you.